My name is Francesco Branca, and I am the director of the Department of Nutrition and Food Safety at the World Health Organization. Welcome to today's session on healthy food systems for people, planet, and prosperity. This is an independent dialogue contributing to the UN Food Systems Summit that kicks off a week-long series of events to highlight the links between food systems and health. The way food is produced, distributed, and consumed affects people's health through 5 main pathways. Unsafe animal food production practices can lead to the spread of zoonotic pathogens and to antimicrobial resistance. Inadequate agricultural practices can lead to pollution of soil, air, and water. Growing, harvesting, and transforming food exposes food workers to occupational hazards and may have an impact on their physical and mental health. Unsafe and adulterated foods, including the ingestion of foods containing pathogens, chemicals, and toxicants, lead to several forms of foodborne disease. And last but not least, unhealthy diets and food insecurity have impact on multiple forms of malnutrition and diet-related non-communicable diseases. The Food Systems Summit convened by the UN Secretary General gives a unique opportunity to develop a new food system narrative centered around upholding human ecological and animal health using a One Health approach. Current narratives do not always recognize these interconnections and would miss the opportunity of a radical food system transformation building on the pandemic recovery process. Today's opening event will discuss the need of new food systems narratives and hopefully catalyze support for an integrated, holistic approach to policy reform and coordinated action across food and health sectors. We will hear how government leaders and actors in the health sector and food systems have designed and implemented policies and practices that have delivered better health and sustainable outcomes. We will hear multiple voices, sometimes singing out of the choir in the spirit of open and transparent dialogue. WHO is committed to ensure that food is safe and healthy, is produced sustainably, and is affordable and accessible to all the world population. In 2020, it established a Department of Nutrition and Food Safety, aiming to guide and support member states to prioritize, plan, implement, monitor, and regularly evaluate multi-sectoral efforts to ensure universal access to effective nutrition actions, safe food and healthy diets through strengthening health systems, building forward better food systems within the animal-human ecosystem interface. Our work has been inspired by the 2014 Rome Declaration at the Second International Conference of Nutrition, leading to the Decade of Action on Nutrition proclaimed by the General Assembly of the United Nations in 2016, and will further build on the 2021 Food Systems Summit. For today's event, we have a large and diverse audience joining us around our virtual table. We have more than 550 registrations for this event from about 90 countries. We encourage your active participation via the chat and Q&A functions. Please use the rename function and indicate your full name and affiliation. Interpretation in all 6 official UN languages can be selected in the bottom function bar. The event is recorded and will be posted on the WHO website. I would like to thank our partners in the organization of this event, EAT, the Global Alliance for the Future of Food, and many others that you will see acknowledged on the Food System Dialogue's gateway. And now it is my pleasure to introduce Dr. Gunhild Stordalen, founder and executive chair, EAT, and chair of Action Track number 2 of the Food Systems Summit. Gunhild, you have the floor.
Thank you so much, Francisco, for those kind words and for your introductory remarks. So, Excellencies, colleagues, and friends, it's a pleasure to see all of you here today. Thanks so much for joining. So even before the pandemic struck the world, science was warning us loud and clear of the clear and present danger of business as usual when it comes to how we produce, consume, and waste food. And then COVID did strike. And COVID was a clear manifestation of the enormous risks of business as usual. Now, a year and a half later, in many ways, we live in a very different world. Tragically, there has been a lot of death and a lot of suffering, but we have also learned new skills like wearing masks, keeping our distance, hold virtual meetings, muting, unmuting, all of that. And governments have learned to do things that were almost unthinkable only 18 months ago, such as locking down entire economies at the cost of trillions. We've learned that we are adaptable, learning beings in adaptable learning societies, and that change can in fact happen incredibly fast. And what underpins this remarkable capacity for adaptation is our ability to alter our mindsets in the face of change. And that has a lot to do with the prevailing storylines or narratives that helps us understand the world around us, because we can quickly change these narratives when the world demands a reinterpretation. And I tell you, this fills me actually with quite a lot of hope. Systems change is possible. We basically have between now and the Food Systems Summit in only a few months to generate a powerful, transformative narrative around food, health, and planet, and to make it take hold in the world, in our society, in our minds, across private and public sectors, and in civil society. I believe that we must build that storyline out from the radically new narrative that COVID has already shaped out there. And that is all about One Health, the health of people, of animals and planets, and that health of all these are inextricably interlinked. So this integrated food system narrative needs a strong imprint by the health sector, positioning food systems transformation as a critical pathway to a healthy and resilient future of all of humanity. Because any talk of building back better from COVID, any talk of pandemic risk reduction that does not include clear action to strengthen the resilience of our food and health systems and to transform the way we consume and produce food, that is not going to help build back better. It's not going to tackle the enormous risks and challenges we are facing. So that is why this meeting today is so important. So I want to again thanking you for being here, and to WHO and Francesco and team for co-hosting this. Over to you, Francesco.
Thank you very much, Gunhild. This commitment is in itself an important sign that we're going to achieve changes together. But for the first part of our dialogue, it's my real great pleasure to introduce our Director General, Dr. Tedros Ghebreyesus. Dr. Tedros, you have the floor.
Thank you, Francesco. And also thank you to Gunhild for her welcome. Excellencies, colleagues and friends, good morning, good afternoon, and good evening to everyone joining us today. And thank you to all the panel members, moderators, and the speakers for your support. At the World Health Assembly last week, I said in my opening remarks that we have come to a fork in the road, that if we go on the same old way, we will get the same old result, a world that's unhealthy, unprepared, unsafe, and unfair. I said that now is not the time for incremental improvements or tinkering at the edges. This is the moment for bold ideas, bold commitment, and bold leadership for doing things that have never been done before. That's true for global health security, and it's also true for transforming our food systems. We need a new food systems narrative that embraces the interconnectedness of humans, animals, and the planet that sustains us. And this is what WHO is working on. We propose a new food systems for health narrative with 5 major pathways through which food systems impact health using a One Health approach. First, unhealthy diets and food insecurity with impacts including overweight and obesity, undernutrition, micronutrient deficiencies, and diet-related non-communicable diseases. Second, zoonotic pathogens and antimicrobial resistance with impacts through farmed, ranged, and wild-caught animals. Third, unsafe and adulterated foods, including those containing hazards such as pathogens, chemicals, and toxicants. Fourth, environmental contamination and degradation through pollution of soil, air, and water resources. And fifth, occupational hazards, including harm to physical and mental health suffered by workers in the food system. Many of today's speakers will elaborate on these pathways. WHO is supporting its member states to take action. We're highlighting actions that can help policy and decision makers deliver impact across food systems for better human, animal, and planetary health. We provide guidance and tools in different areas of work, including public food procurement and services, food reformulation, fiscal policies, regulation of marketing of food and beverages, including breast milk substitutes, nutrition labeling, food fortification, food safety, and control of AMR, and many others. Even prior to the pandemic, the root of many of the world's most pressing threats to human, animal, and planetary health were unhealthy, inequitable, and unsustainable food systems. As we recover from the devastation of COVID-19, we have to think ahead and build forward. Now is the time to get our food systems right. This is the year of action on nutrition, and we are halfway through the UN Decade of Action on Nutrition. The UN Food Systems Summit is itself a call to action to prioritize human and planetary health. Let me leave you with 3 priorities. First, we must work with a One Health approach that addresses the intimate links between humans, animals, and the environment. Second, we must work across sectors to harness the comparative advantages of government, the private sector, and civil society. Third, we must build a new narrative that nurtures health at every stage of food system, from farm to fork. I thank you. Francesco, back to you.
Thank you very much, Dr. Tedros, for this clear call to action and for stating WHO's commitment to act for food system transformation. Bold, bold, bold. Thank you for your leadership. And now it is my privilege to introduce Dr. Agnes Calibata, the UN Special Envoy to the UN Food Systems Summit. Dr. Calibata is responsible for outreach and cooperation with many leaders, including governments, to ensure the summit serves as a catalytic process within the decade of action to improve food systems around the world to deliver on the Sustainable Development Goals and the Paris Agreement. Dr. Calibata, you have the floor.
Thank you, Francesco. And let me start by endorsing all the recommendations you're making, Dr. Tedros. That's a huge contribution to this dialogue. And let me thank you, World Health Organization, and other partners for putting this dialogue in place so that we can have an opportunity to discuss some of our biggest challenges. Our health system, our health is powerfully links us to animals, but also links us to our environment. And so is a very central pillar and a key outcome of our Food Systems Summit conversations. Today, we have designed our health to provide us, we thought that our food systems have been designed to provide us with food. But what we are getting today is a lot of obesity, like has been indicated by some people. What we are getting today is failure to deliver on hunger and nutrition, as we see in some parts of the world. And what we are getting today is a huge impact on the environment, especially knowing fully well that we are contributing 80% to biodiversity loss and so many other things that we don't want to see happening in our food system today. So we have an opportunity through the food systems conversation to call to what many have already talked about, the One Health system, to put the One Health system at the center of the conversation that we are having. Luckily, this is already coming out across all our action track conversations and is coming out across all our dialogues. We have designed the dialogues to ensure that people have an opportunity to discuss some of our biggest challenges in our food systems. At country level, we have over 120 dialogues now taking place in different countries. And these are providing an opportunity for all of us to look at the interconnectedness between our health systems, between the environment that we work with, and how these things are impacting us as we see from a COVID perspective and beyond. We have also designed action tracks to come up with huge number of ideas. Now we are talking over 2,500 solutions now that provide an opportunity for us to look at the type of solutions that can start helping the shift of our food system. So the question is not whether we should shift. There's huge agreement around the shifts that are needed in our food system. The question is when and how fast. And that's the reason of the Food Systems Summit, recognizing that we are behind in a number of places, and we are behind on some of the most critical that impact our health. So it's really, really important that we take advantage of the opportunity that these dialogues offer to support countries to come up with clarity of conversations around who needs to be around the table when, but also with clarity of conversations around the type of policies that need to be in place as we advance the conversations past the Food Systems Summit. So I hope that we don't squander, and I'm going to use the word very intentionally, we don't squander the opportunity that the Food Systems Summit is giving us to pivot our food system into something that works for all of us. We have a lot of inequity in our systems. So we need our food system to work for us from a health perspective and from a food perspective. So I hope that we use these opportunities of these dialogues to highlight those things more and to make sure that they come out as we go into the pre-summit, the 26th to 28th of July, and to the summit in September on the sidelines of the UN General Assembly. I thank you all, and please stay with ensuring that our food system delivers all the expectations that we have from it and the need for us to pivot and ensure that the pivots happen in our food system for people, for our planet, and prosperity. Thank you so much again, Francesco.
Thank you very much, Dr. Calibata. Thank you very much, Agnes. You have really reminded us and made us very happy to understand that the focus will be nutrition and environment. And you have highlighted the interconnectedness between health and food systems. But also you have reassured us by saying that, there are solutions there, over 2,000 solutions. Important is when and how fast. So we're all committed to work with you to make this summit a success. And we're now going to hear from Mr. Guy Ryder, the Director General of the International Labour Organization. Dr. Ryder is actually, as we speak, talking at the ILO assembly, so he sent us a recorded message.
COVID-19 has devastated our lives and it's plunged the world into an economic and social crisis. Massive job and income losses have pushed millions into poverty and into food insecurity. Lower earnings and rising food prices mean that many households have had to cut down on both the quantity and the quality of their food. And the harm done by poor nutrition is well known. It affects not just long-term health, but livelihoods and productivity too. And the current crisis exacerbates this negative impact. COVID-19 has shown how closely related these challenges, public health, food security, and labor, are really interrelated. And it's also exposed the fragility of our food systems. So it's clear that an integrated approach, which addresses multiple challenges in a holistic way, is needed to build their long-term resilience. Tackling the decent work deficits in the agri-food sector needs to be an essential part of this. Agricultural workers regularly face poor working conditions, high levels of working poverty, and a lack of access to rights. In some countries, they are specifically excluded from key legal protections, such as minimum wages, paid sick leave, and the right to organize or to social protection. For the many casual or migrant agricultural workers, the situation can be even more precarious. And agriculture is one of the most hazardous sectors. It accounts for a large proportion of all fatal workplace accidents. Millions of agricultural workers suffer workplace injuries or poisoning by agrochemicals. And yet, despite all these risks, food and farm workers have continued to work during the pandemic to ensure our food supply. In doing so, they've increased their own exposure to COVID-19, as witnessed by the multiple virus outbreaks at food processing plants and farms around the world. Guaranteeing safe and healthy working conditions, better incomes, and greater protection for agri-food workers is critical. It's critical if we are to build food systems that can withstand current and future crises. Ratification and implementation of ILO conventions will be particularly critical, both fundamental rights conventions and those that specifically target agriculture. And social dialogue will help to find solutions that work for all. If we improve the quality of work in agriculture, we can also unlock the sector's potential for decent job creation and attract young workers. And applying new technologies, especially to improve environmental sustainability, will be equally important. We must seize this chance to rethink the way we work with and live from our environment. The transition to a greener economy will certainly have an impact on employment. Some jobs will disappear, others will emerge. Enterprises will need to find new ways to organize work and to produce the food that we all need. But by ensuring this transition is truly just and truly sustainable, we all have much to gain. In reforming the economic and social fabric of our food systems, we can also lay the foundations for environmentally sustainable, socially inclusive production and consumption.
Thank you very much, Dr. Ryder, for reminding who is feeding us and talking about the vulnerability, economic and health vulnerability of agricultural workers, but also highlighting the solutions there and highlighting that the economic advantages are win-wins, can be win-wins with environmental sustainability. And now it's my pleasure to hand over the moderation of the next panel to Ruth Richardson, good friend and partner. Ruth is the Executive Director of the Global Alliance for the Future of Food and currently serves as the chair of the Champions Network for the UN Food Systems Summit. Over to you, Ruth.
Thank you, Francesco, and hello, everybody. I'm Ruth Richardson. Greetings from Canada. As Francesco said, I'm the Executive Director of the Global Alliance for the Future of Food, and I'm delighted to echo Francesco and Gunhild's welcome to you all to this timely session today. And we are thrilled to partner in this event with them. I'd also like to thank the opening speakers, and as Francesco said, I'll be your moderator for the next part of the agenda. The Global Alliance is a strategic network of philanthropic foundations working to transform global food systems. We believe in the urgency of transforming food systems and in the power of working together, especially and with others, to effect positive change. Our work is guided by a set of 7 indivisible principles: renewability, resilience, equity, diversity, health, inclusion, and interconnectedness. And these principles shape both our vision of the future of food, and importantly, they also tell us how to act into these challenges that others have talked about. Acting on these principles, we combine systems thinking with collaborative action, so the ways in which we grow, process, distribute, consume food leads to a more resilient and equitable future for all. As others has said, food systems transformation is urgent. Today's model of industrialized food systems is pushing the health of people, animals, and the planet to the limits. It has taken a pandemic for the world to confront this reality. Now is the time to address the root causes of food systems failures and together strengthen the demands for transformation in the places and spaces where we can all have impact. At the Global Alliance, for example, we're doing this by advocating for a set of 7 interconnected calls to action in global processes this year, like the UN Food Systems Summit, and focusing on shifting the narrative about food systems, convening diverse communities to generate a confluence of perspectives, and where possible, to find collective pathways forward together. The complexity of food systems transformation is real and challenging, but business as usual is simply no longer an option. Food systems must be placed at the center of the global agenda as a way to integrate, align, and cohere across issues that are inextricably linked. After all, while food systems are a significant factor in the creation of the urgent global challenges we face, from climate to COVID, they can provide brilliant pathways to the solutions that we urgently need. So with that, let's get into 2 topics at the heart of the health food systems nexus. First of all, malnutrition in all its forms, and secondly, antimicrobial resistance and zoonosis. This before turning to a final panel on global systemic action. So welcome to all who are joining, and let's dive into our agenda. Our first session is on malnutrition in all its forms: diet-related non-communicable diseases, including obesity, undernutrition, and micronutrient deficiencies, and their impacts on public health and healthcare systems, and how they have been exacerbated by COVID-19. Before we jump into the panel discussion, we'll listen to opening remarks from Dr. Sania Nishtar. Senator Dr. Sania Nishtar is a member of the Senate of Pakistan and Special Assistant of the Prime Minister. Unfortunately, Dr. Nishtar could not join us today, but she has sent a pre-recorded video. Please, let's run the video.
Excellencies, ladies and gentlemen, thank you to the organizers of this high-level independent food systems dialogue, the World Health Organization, EAT, and the Global Alliance for the Future of Food for the opportunity to speak today. I'm encouraged to see this dialogue occurring, and I'm very glad that we're taking the necessary time to understand and leverage the nexus between health and food systems. In Pakistan, we feel the relationship between our food and health systems acutely, and in many situations, the challenges we face with the 2 systems have resulted in impacts that are often one and the same. While the number of people experiencing hunger in Pakistan has decreased over the last 2 decades, this decrease has not necessarily translated into better access or consumption of healthy diets or improved health outcomes. Like other low and middle income countries, the shift in global food systems has meant that Pakistan now faces the double burden of malnutrition, which essentially means that we face high prevalence of both undernutrition and overweight and obesity, as well as diet-related non-communicable diseases such as diabetes, often within the same community household or within the same individual, and often amongst the most vulnerable segments of the population. Pakistan's nutritional status has, in addition to human suffering and burden on our health systems, an economic consequence as well, which is why Prime Minister Imran Khan identified malnutrition and stunting as major health challenges. And during his first speech to the nation, expressed that efforts for their mitigation were his priority. To fulfill this policy commitment, we have launched Pakistan's first health and nutrition conditional cash transfer program, which combines consumption of specialized nutrition food with cash transfers and immunization, in addition to antenatal care and health awareness sessions. During COVID-19, 15 million families received Asas emergency cash, and the subsistence amount that was given was used for food and food rations in 97% of the cases. We are expanding our safety net, and the COVID-19 pandemic makes this action even more relevant than ever. To conclude, I would like to say today that if we want to achieve the global nutrition targets and end malnutrition in all its forms, if we want to ensure a healthy, fair, and safe future for our children as leaders, we need to make data-driven financial, policy, and programmatic commitments covering the following three critical focus areas: integrating nutrition into universal health coverage, transforming the food system so that it delivers safe, sustainable, and healthy foods to support people and planet, and thirdly, effectively addressing malnutrition in fragile and conflict-affected contexts, ensuring resilience of food and health systems. I thank you.
Thank you, Dr. Nishtar. Very important points about the complexity of the problems, which we're starting to understand more and more, and also very importantly, pointing to how countries are finding pathways and solutions. Also a central part of the UN Food Systems Summit as we look to member states to chart ways forward to deal with some of these very critical challenges. We are now joined by two panelists to give us their perspectives on the links between human and planetary health. Michael Sanbola is the CEO of Lagos Food Bank Initiative. Welcome, Michael. Dr. Juan Rivera is General Director of the National Institute of Public Health in Mexico and Professor of Nutrition at the Mexican School of Public Health. Welcome, Juan. I have a couple questions for each of you. And since this is in the context of the Food Systems Summit, it would be great if you could comment, if possible, in terms of the whole food system. In other words, production, processing, consumption, waste, and other aspects of the system. So Michael, first to you. Can you briefly explain the aims of the Lagos Food Bank Initiative and how you're addressing all forms of malnutrition? And second, how COVID has highlighted the importance of your work?
Okay, thank you very much, Ruth, for the introduction. And I also want to thank the Global Alliance, the WHO and EAT for putting this event together and giving me the opportunity to contribute to the conversation currently ongoing on sustainable food system for people, planet, and prosperity. So essentially, my contribution is kind of centered on the impact of or the critical role food banks play in the transformation of our food system. And that's where we come into place as a food bank to bridge the food gap and also improve nutrition security and food security, essentially. Sincerely, we cannot effectively talk about the transformative food system without talking about the key role that food banks play, especially during the wake of the COVID-19, where the COVID made a mess of our entire food system, and how food banks stepped forward to bridge that gap and offer instant relief to people, essentially. So, and we know that food security, of course, is the cornerstone of a transformative food system, and that is at the core of every activity of a food banker or food banking generally. So essentially at the Lagos Food Bank, we are about food security and improving the nutrition of pregnant women and children. Of course, our mantra basically is to break the food gap, cut food waste, and also do targeted programs that seek to improve nutrition of pregnant women and children. And so far since inception, we've been able to impact more than 1.5 million people, especially in Lagos. Lagos is a city with more than 25 million people, and it grows almost 100 persons per hour. And as we see, a lot of people are at the verge of food insecurity and because of rural urban migration. And also, of course, because of the impact of COVID, at least globally, we know that at least more than 132 million people currently at risk of hunger as a result of the COVID. And we know that this also has an impact on globally and even locally at what we do at Lagos Food Bank. So we have these nutrition programs, first programs that meet the direct need of people, instant need of people, programs that seek to improve the nutrition of children in public, in low-cost private schools. We have a school feeding program that seeks to increase the nutrition of school children. And specifically, we have a program that addresses people living with diabetes, people living with non-communicable diseases, diet-related non-communicable diseases. And these programs helps to improve their nutrition. The most important thing we have to bear in mind is that, of course, food prices have gone up by 38% within the last 1 year. And no matter how affordable food becomes, there are some people who still will not be able to afford this food. And that is where we are. That's where food banks come in to carry this most vulnerable population along. From what we've experienced from the field and the number of malnutrition, the people living with malnutrition that we've encountered, we've realized that most of them, most of the time, are unable to buy the food that will make them improve their nutrition. And even the primary healthcare centers are not equipped with the constant supply of food for these families. And so we get reference from there, and then we place them on constant supplies of food. And then we see an increase and how they are able to gain weight. So essentially what I'm trying to say in essence is that food bank has a very key interrelation. There's a key interrelationship between the works of food bank and public health, and the fact that food banks, aside from creating or attending to the needs and daily needs of its beneficiaries, also has programs that targets improvement of nutrition and of most vulnerable population. And this has a key link to the works of food banks and food banking all around the world, essentially as it concerns the transformation of our food system. So, okay.
Thank you, Michael. Very important points around the reality of food insecurity, especially for vulnerable populations. You mentioned pregnant women and children in particular, and also just the stark reality of the need, especially in light of COVID. Thank you for all the very good work you're doing and really appreciate your comments. We'll come back to you in a sec. I'd like to move over to Juan. And Juan, can you briefly talk about the work of the National Institute of Public Health in tackling malnutrition in Mexico, and what measures have been most impactful?
Thank you very much, Ruth, and thanks for inviting me to this very important Food System Summit. So Mexico has been relatively successful in reducing stunting and micronutrient deficiencies. For example, stunting dropped in the last 3 decades from 20% to 14%. And I think that what worked was a combination of nutrition-sensitive actions, such as the provision of nutrition supplements and nutrition education, along with the access to health care of children under 5, targeted to the poorest population, and with conditional cash transfers to incentivize the utilization of those services. And this program was also, applied at the national level, national scale, with a huge coverage. And in addition, during this period, Mexico experienced a steady poverty decline, which I think was also an important factor in the success. However, let me tell you that between 2012 and 18, stunting did not decline anymore. And as a result of the impacts of COVID on income, food security, we are expecting a potential increase in stunting in Mexico, which will be very, very sad. On the other hand, during the same period, we experienced a huge increase in overweight and obesity in Mexico. For example, in adults, we went from 35 to 70% of overweight and obesity, and in adolescents from 11 to 40%. And we have faced a very, very high lethality from COVID-19 as a result of obesity and chronic diseases, an epidemic that we had in Mexico before COVID. So in the last 7 years, we have implemented measures to limit the availability and accessibility of unhealthy foods and beverages through taxes, limiting availability to children through school regulations, restraining advertising of unhealthy food to children and adolescents, and providing simple and clear information to consumers, and trying to reduce food ultra-processing through front-of-pack warning labels. And we are implementing now those labels in Mexico to reduce the intake of unhealthy ultra-processed food. Some of these actions have been evaluated and have had an impact. Now, we have not been able to include actions to promote the production and supply of healthy and sustainable food using environmental friendly techniques, and to regulate unhealthy food processing and to reduce food waste and to promote healthy and sustainable diet through appropriate incentives and novel food guides. So we realized that in order to be effective in tracking obesity and its comorbidities and undernutrition, we need to continue building a package of policy actions aimed at modifying our broken food system, which has not been able to get rid of undernutrition and micronutrient deficiencies, which has been the main factor in the obesity and non-communicable disease epidemic, and which is one of the most important drivers of the deterioration of our environment, threatening local ecosystems and the stability of Earth systems. Thank you, Ruth.
And thank you so much. I want to pull up a couple of things that I found particularly important. I really appreciate your connection to poverty. The Global Alliance did a report called Unraveling the Food Health Nexus with the International Panel of Experts on Food Systems, IPES Food. And there is a really interesting piece of work there around the connection between poverty, climate, food, and health. So thank you for that. Also very interesting, the work that you've done on taxes and regulation in particular. I know that within the Food Systems Summit conversations, many countries are looking to other countries on where to find inspiration and help. And so I think we really have to hold up the examples where countries have been able to take bold steps to address issues. So very much appreciate that. And then thirdly, just want to appreciate your connection to production. We often talk about nutrition, in particular in the absence of production. And so really appreciate the links to agroecology and ecological ways of farming as a pathway to get to good nutrition. So thank you both. We're going to come back to questions to you. But before we do, we would like to get the audience's opinion on opportunities to address malnutrition. So if you could please run the poll. Audience, participants, the question for you is, where is the biggest opportunity for governments to address malnutrition in all its forms? There are 8 options to choose from. Please also feel free to add any other ideas or suggestions to the chat box so that your fellow participants can see and comment. And while you're answering the poll, we'll start the Q&A panel. So I don't see the poll, but I will assume it is running. There we go. Now I see it. So yes, please, participants, fill out the poll. Meanwhile, I'm going to go to questions. The first question I have is, many of the previous speakers and both of you have talked about equity. Dr. Calibata spoke about it. Many of the other speakers did too. We know that malnutrition doesn't affect everyone equally, but really affects the most vulnerable. And we're talking about women, we're talking about children, we're talking about marginalized individuals, we're talking about vulnerable communities, indigenous communities. So Michael and Juan, how do we really place equity at the center of our solutions? Michael, I'm going to start with you. You're on mute.
So essentially, the way to go about this for me is, of course, ensuring that everybody is carried along. Of course, as you can see, inequality has been further widened by the advent of COVID. And And the way to go about this, of course, is ensuring that we work with the third sector, the non-profit organizations that have close link with the people, the most vulnerable in their communities, and that serve people directly in their communities. So really, it's more of a collaborative approach to ensure that everybody is carried along and no one is left behind, and more so, also ensuring that the intervention is across board and all stakeholders are being carried along to reach the most vulnerable in the society.
Thank you, Michael. Juan, what about you in Mexico? What's your experience in terms of ensuring that equity is at the center of your responses and solutions?
I completely agree with you, Ruth, particularly in Mexico and Latin America, which are very unequal countries. For example, the gap stunting in Mexico, we have about 14% average, but the poorest population has prevalences of over 30%, while the wealthy populations has less than 5%. And this has to do with food insecurity, has to do with the lack of access to sanitation, to water, to healthcare systems. So we really need to make an effort to have those services provided to the low-income population. For example, in Mexico, our programs have been targeted to the very low-income population, and particularly to the indigenous population in Mexico. 10% of Mexicans who have lived always behind, and we really have a debt with them. The other thing that we also should do in transforming our health system is to think about small farmers, about day laborers. They produce our food, and they are the poorest people in Mexico. So we really need an equity guide, both in combating undernutrition, overnutrition, and in the transformation of our food system.
Fantastic. Thanks, Juan. Michael, there's a question from one of our listeners about how you're addressing sustainability at the food bank. I'm not sure if they mean sustainability in terms of environmental sustainability or sustainability in terms of how the program continues to flourish over time, but maybe you could speak to both of those elements. Michael, over to you.
Okay, thank you very much, Ruth. So in terms of sustainability, of course, sustainability is at the core of what almost every food bank activity is about, and how to ensure that these interventions are being carried on uninterrupted to the most vulnerable in society. Of course, we work with, there's sustainability on two angles. That's sustainability in terms of funding to carry on the activities, and sustainability on the part of the beneficiaries. To what extent does the intervention, make them self-reliant and make the entire intervention sustainable? So in terms of funding and partnerships, of course, we've been able to partner with corporate bodies, the civil society, organizations, networks like the Global Food Banking Network, who support with funding, and private individuals as well, to carry on activities in such a way that we do not stop these interventions to the most vulnerable. And for the beneficiaries who get these interventions, of course, we look at how do we make them self-reliant, how do we make them more resilient, and also provide for themselves. So we have programs like the family farming program, like urban farming, where we train women on how to grow food at their backyard, and also enable them to sell part of this and eat close to the soil, and also be able to sell part of what they produce. We also marry the skills of our beneficiaries with available job opportunities around, because we realize that they have skills but don't have the market. So we create CVs for them and publicize their skills to people who might probably want to marry their skills with job opportunities to make them self-reliant. There are other several ways that we've been able to drive sustainability for our beneficiaries, just to ensure that they are taken out of the hunger line. We are not just feeding the hunger line, but ensuring that these people are being lifted from that state of vulnerability to a state of self-reliance. And these are the things we are doing on both angle of funding and then concentration on the beneficiaries to ensure that they are very much self-reliant. Thank you.
Thank you so much. And hopefully the two of you can see the questions in the Q&A box. And I really encourage you to answer those directly. There's some very good things in there about monitoring and evaluation, and about elevating the voices of farmers and day laborers as critical. So it would be great to get your comments in there. I think just before we close up this session, one of the other questions that I wanted to pose to the two of you, which I see sort of embedded in some of the participants' questions, is really sort of what are the key challenges that you're facing, and what is the role sort of for collaboration and working with others? There's a very strong theme around collaboration, obviously, in the UN Food Systems Summit, bringing sort of diverse perspectives and different stakeholders together. So challenges, and then, you know, how you're thinking about the need to connect with others, partner with others. So Juan, maybe I'll start with you first.
Thank you very much. I think that the great challenges to, for the transformation of our food system in order to improve the health of people and the planet is that it is very complex. You really need a multi-sectorial, multi-stakeholder approach, and with a whole system perspective. The Mexican government has created such a program. This is a multi-sectorial program that includes the Ministries of Health, Agriculture, Environment, Education, Economy. The Spanish acronym of this program, I hope it will become known in the world, is HISAMAC, and it also includes NGOs and academia. And the idea here is to really transform our health system so that it becomes healthy for the people, for the planet, and then also equitable. So it really improves the lives, particularly of those small producers, small farmers, day laborers. And we have already had a number of actions. For example, the warning labels in Mexico, in part, were really implemented as a result of this collaboration. Mexico has now banned glyphosate. So it really is trying to reduce pollution through agriculture. I mean, it's very polemic, it's been terrible, the reaction, particularly of the commercial sectors in agriculture. And we are trying to now use, for example, incentives such as subsidies that we already have to favor the production and supply of healthy foods in minimum processing, supporting agroecological and small farming, reducing food losses, and at the same time, working, for example, updating our food guidelines for healthy and sustainable diets. So it's a set of changes, including also the school system, including taxing, warning labels, food advertising, regulations. And I think that if this works, and I know that in many countries, these efforts, these multi-sector efforts have failed. But if we are able to work together, I think that this will be a very important contribution, because in my opinion, that's the biggest challenge. We cannot solve the problem with isolated small interventions. We need a package of interventions with a systemic view.
Fantastic. Thank you, Juan. We'd like to look at the results of the poll, but before we do that, Michael, just very quickly, main challenges and the role of partnerships.
Okay, so thank you very much. I will just start with the role of partnerships, because what we do, for instance, at the Lagos Food Bank, ensuring that we're able to connect with the most vulnerable. When we saw that the COVID stretched us and we had to be innovative and see ways in which we carry on other non-governmental organizations who are much closer to their community. So we onboarded additional over 100 non-profit organizations who come directly to the Lagos Food Bank to access food and also some form of technical assistance to serve their communities, just to ensure that we have this holistic approach to solving the problem of food insecurity. And then when food items, we receive them like that, and they have lifespan, we also make use of other non-profit organizations to ensure that these foods are immediately redistributed to curb food waste. So we work with non-profit organizations and over 100 of them to reach the most vulnerable in the community. And then the fact that the challenge that we are currently facing now is that of the fact that the concept of food banking as an integral part of the food system is still being underplayed. And we want that, that form of voice and exposure to the impact we are having in the community and ensuring food security. Because of course, food security, of course, is the cornerstone of food system, like I said earlier. And that, of course, is what we need at this time. Thank you.
Fantastic. Thank you both, Juan and Michael. Very inspiring. And thank you for all the good work that you are both doing. Let's now take a quick look at our poll and see the results. Here we go. So the question was, where's the biggest opportunity for governments to address malnutrition in all its forms? Top answer, an integrated approach to policy. By far the top answer, and then improving health literacy among decision makers, financial investments to malnutrition projects and interventions, agricultural production systems that incentivize public money for public goods, and so on. Very interesting. So an integrated approach to policy comes out as a striking #1. All right, let's go to our next panel, which is on antimicrobial resistance and zoonosis, how the increased use of antimicrobials and the emergence of a range of zoonotic diseases are diminishing animal health, exacerbating the human health crisis, and contributing to the ecological crisis, as demonstrated by COVID-19. Before we jump into the panel discussion, we will listen to some opening remarks from Dame Sally Davies. Dame Sally Davies is the UK government's special envoy on antimicrobial resistance, is also a member of the new UN Global Leaders Group on Antimicrobial Resistance. Dame Sally Davies is speaking at the G7 this week, so she can't join us in person, but she has provided a video. Please, if you could run the video.
I thank the World Health Organization, the Global Alliance for the Future of Food, and the EAT Foundation for hosting this important dialogue on food systems. Healthy food matters to all of us, so do the systems to produce it. I care about this. And we must recognize that effective antibiotics and antimicrobials are critical infrastructure for food systems as well as health systems, and both are connected. Antibiotics are essential to enable farmers themselves to live healthy and productive lives, and for their food-producing animals to be treated when they are sick. Yet their very use drives the infecting bugs to develop resistance. I have been advocating for tangible and ambitious action on this resistance, known as AMR, for almost a decade. I started campaigning as Chief Medical Officer for England to get greater recognition for AMR. I co-convened the UN Interagency Coordination Group on AMR to generate momentum and advocate for national action plans and collaboration across every country and sector to act on AMR. And now, as a member of the United Nations Global Leaders Group on AMR, I'm working with politicians and experts from across the world to catalyze political action so we can build back from COVID-19 and build forward to the Sustainable Development Goals. We do this because infections maim and kill, so we need effective treatments. This means that AMR is a global issue. AMR matters to humans, to animals, to the environment and the food chain, and to the sustainability of the entire planet. AMR is a challenge the whole world faces, and one that requires collaboration across the world to address it. AMR is a slow-growing pandemic, only visible when we look for it. Yet our dependence on antimicrobials has become so excessive that our systems are now unsustainable and our treatments are becoming less effective. This silent pandemic is on the rise, and if we don't get our act together, it could kill 10 million people each year by 2050. You see, antimicrobials have been used for food-producing animals to promote rapid growth for a faster route to market. That increases the prevalence of antibiotic-resistant bacteria in animals and potentially untreatable infections. This approach is short-term and risks the sustainability of our food systems in the future. We're all here in this dialogue to show the strength of multilateral, collaborative action and innovation, to discuss and share solutions and the actions we can take to make progress on AMR together, as well as on ending poverty and hunger and building secure jobs. This is not about blame. After all, I'm so proud to tell you that through a collaborative and multi-sectoral voluntary approach to antibiotic stewardship in livestock production, antibiotic sales for food-producing animals in the UK has halved since 2014. This makes the UK one of the lowest users of antibiotics in agriculture amongst those countries with a significant livestock farming industry. This highlights the benefit of collaboration from public to industry, civil society, and government. Collaboration and sharing best practice are key. It's the only way we hope to see similar reductions in antibiotic sales across the world. Our countries can all learn from each other, and today I hope to learn from you. The UK is using our G7 presidency this year to bring partners together and take bold steps on AMR. Last week, the G7 climate and environment ministers committed to help take action across the whole One Health spectrum to reduce inappropriate use of antimicrobials and to make the manufacturing of antibiotics more friendly for the environment. This is such an exciting step. But our planet and food systems belong to all of us, not just to one country. It's important for AMR to be at the heart of conversations at the upcoming food systems and the COP26 summits later this year. Today's conversation is raising the noise level on this issue, but we need to be louder and louder together. I challenge you to make the solutions we do see more sustainable and scalable. From farm to fork, from farmer to consumer, we need collaboration and innovation with evidence and action. We need to share good practice and join it up so infection prevention and responsible, sustainable antimicrobial use becomes a social and economic norm. Our planet depends on this. And I really want to face my grandchildren and say, we took action. Thank you.
Thank you to Sally, a very, very passionate plea to the globe, and also another example of both personal and country leadership on a very critical issue. So appreciate those comments. We are now joined by two different panelists to give us their perspectives on the links between human, animal, and planetary health in the context of AMR, or antimicrobial resistance and zoonosis. First, we have Dr. Rajeshwari Sinha, who is Program Manager in the Food Safety and Toxins Unit of the Center for Science and Environment. We also have Dr. Darika Kenyate, who is Advisor to the Office of International Cooperation at the Department of Disease Control, Ministry of Public Health in Thailand. Welcome to you both. I have a couple of questions for both of you. And again, since this is in the context of the Food Systems Summit, it would be great if you could comment, if possible, in terms of the whole food system. So first, Rajeshwari, can you briefly explain the work of the Center for Science and Environment in tackling antimicrobial resistance? And in India, what are the opportunities to tackle these issues, which have been so highlighted by the pandemic?
Well, thank you very much, Ruth. Firstly, for getting my name right. It's a difficult one. And secondly, thank you for getting us on board this event. I would like to congratulate first the organizers, the WHO, the EAT Foundation, and the Global Alliance for the Future of Food for putting together this very important discussion. And also, thank you for having us here. I am talking on behalf of the Center for Science and Environment, and to let you know briefly what we do in the context of AMR. So CSE is a public interest research and advocacy organization which is based in India, and one part of our work deals with the food safety and toxins, where we have been working to address this issue of antimicrobial resistance, which is a global public health issue and is finding significant linkages to food systems that we are going to talk today. today. Our work involves research and advocacy on this issue, and to be able to push for change both in policy and practice. And while at one end we work in India, on the other hand, we're also working at the Pan-Africa and Pan-Asia level, and in particular hand-holding few African countries on implementing the national action plans on antimicrobial resistance. Given our experience of working with the developing part of the world, we also share our perspectives from the global south at several global platforms. That's in brief about what we do. Coming to the second part of your question, where we might talk about the opportunities to tackle these issues. We are bravely fighting one pandemic, and like we heard in the previous video, there is another one which is quietly threatening us, which is the silent pandemic of AMR. It has been rightly termed so after COVID came into being. However, this current pandemic has given us, certain lessons and some unique opportunities to act on AMR. The most pressing issues to begin with, such as health, need for better investments in infrastructure in health, universal and equitable access to vaccines, the importance of preventative healthcare, all of these have come up on the healthcare agenda, which allows us to upscale action on this issue. We have learned how the importance of pandemic preparedness is important to be able to contain this pandemic. Clearly, we can see that prevention is going to be key in containing pandemics during the current time and in future. If I have to talk from the food systems perspective and link it with AMR, the issue of food production and AMR is something on which there is a lot of understanding, and we need to do something about it. Even that we know. A large amount of antimicrobials or antibiotics in particular are used in food systems like livestock, the poultry sector, or even in growing crops, not only to treat infections for therapeutic purposes, but also for non-therapeutic options such as routine mass disease prevention or growth promotion. Now, this is going to have major implications on the issue of antimicrobial resistance, and more so in the current day food manufacturing system, where the demand for food has grown and it needs to be met. Farming systems are sorting to becoming more and more intensified, and as such, antimicrobial use in these kind of systems seems that they have become a part of the toolkit for enhancing food productivity in less time. At times, this is even termed as justified, as because it's critical for the livelihood security of farmers. While intensification is believed to help address this future hunger and nutrition needs, but at the same time, this excessive dependence on chemicals can go on to jeopardizing the health of the people and the planet. The use or misuse of antibiotics is therefore about the very system of food. It's about how we have raised animals or crops, whether they have been given access to outdoors, how they have been stocked into a little facility or given space, how we have changed breeds from more resilient, disease-resilient ones to productivity-oriented breeds, or even how we have changed our diets, what type of diet the consumer has chosen. Therefore, it is time that we rethink our relationship with food and how we have grown it. This is a tremendous opportunity for us to rethink. But I must also say that I come from the developing part of the world, and we are still not entrenched into over-chemicalizing or over-toxification of our food systems, and there lies a very big opportunity. If we get things right with the right amount of guidance and the right indicators, we should be able to, set our house straight. Over.
Fantastic. Thank you so much. There's some themes there I want to pick up, which I will do so in a second when we get to some additional questions. But first, I'd like to turn to Darika. Darika, can you briefly explain how the Thai government is tackling zoonosis? And do you think that the pandemic is an opportunity to highlight the links between ecosystem and human health with regards to AMR and zoonotic disease? Please go ahead.
So, thank you very much, Ruth. Thank you, WHO, for providing opportunity for Thailand to share with us all on the fight against zoonosis and AMR. I would like to begin with that Thailand is very confident in using the One Health approach to promote multisectoral and multidisciplinary collaborations in managing these two problems all along in the food production system. So I thank very much that WHO has organized this platform so that the world move hands in hand together. I think we still have problem all around the world with the food safety, food security, poverty, and bad health, this kind of thing. So in answering your question, what have the Thai government been tackling with zoonosis? I'd like to begin that Thailand has established a national zoonosis committee composed of Department of Disease Control, Department of Livestock Development, and universities, both medical school and also veterinary medical school. So this is a very good, had been a very good platform for very close cooperation. And this has proved that it is very effective in controlling major zoonosis like anthrax, trichinosis, and also rabies. We haven't had any anthrax or trichinosis for many years already, and we aim to eliminate rabies within the timeline within of the WHO. So, and when we look back into the avian influenza outbreak in 2004, Thailand has established the National Executive Committee on Emerging Infectious Diseases, chaired by the Deputy Prime Minister, and the Secretariat Group has worked closely. There are four of us: the Department of Disease Control, Department of Disaster Prevention and Mitigation, Department of Livestock Development, and also Department of National Park and Wildlife Conservative. And this is the multi-sectoral and the multidisciplinary there are also subcommittees that working under this national committee. So it is kind of One Health approach already. And we had used that to control the avian influenza very well. And we also established the National Strategic Plan for Emerging Infectious Diseases with the vision that Thailand can be able to systematically, effectively, and promptly prevent and control those emerging infectious diseases by using this One Health approach. And after that, in 2014, Thailand has become the member of the Global Health Security Agenda, and with the aim to support the WHO International Health Regulations 2005 implementation. So, and we also volunteer, which is approved by our government, to be the lead country on the National Health Laboratory System Action Package and also the Workforce Development Action Package. We also use this opportunity to work with ASEAN. So we had initiated the ASEAN +3 Field Epidemiology Network to work together within the ASEAN. And one initiative that we think is important is the veterinary field epidemiology program. This means that we can develop the workforce on the veterinary side as well. And for AMR, the Office of the Food and Drug Administration Committee, or FDA, has established the national strategy to fight AMR. And we had done the laboratory surveillance on AMR as, guided and supported by WHO for many years already. And so the Public Health Ministry also try to coordinate with all concerned sectors with the food, animal health, all sectors, the livestock, the fishery, health, so that we can tackle the AMR problem. The One Health approach has been strengthened at all levels through the model development, through the establishment of the National One Health Center, and also through the implementation of law and regulations. We have the Communicable Disease Act, which is in line with the IHR, and we ask all provinces to establish the multi-sectoral provincial communicable diseases committee, which is chaired by the provincial governors. And this provincial committee, multi-sectoral committee, has been very active in managing public health threats since then, including the COVID-19 pandemic in all provinces. So this is what we have been doing in a bigger picture. And for your second question, can I answer you now, Ruth?
Yes, just very quickly, because we want to get to some of the audience questions.
Okay.
But yes, please go ahead, Darika.
Okay, it will be very brief. The challenges and opportunities for food and health system actors to address these two problems would include working towards the same goal, having the national, and secondly, building multidisciplinary or One Health workforce. Third, effective law enforcement. Fourth, effective risk communication. You need to have the public and the other sector, private sector, to help you to do the same thing, hand in hand. And the last thing I would like to address is that Thailand has been, follow the King Rama IX's sufficient economy philosophy, or SEP, which has been announced by the UN to be one of the foundation for the SDG. And we believe that this would be the foundation for us in moving towards the sustainable green farming. Thank you all. Over to you, Ruth. Thank you.
Thank you, Darika, for sharing all your experience in Thailand. Very interesting. Before we go to some additional questions, again, we'd like to do another poll with the audience and the participants on their opinion on the One Health concept. I see the poll has come up. Same process as before. The question is, One Health is a concept that is increasingly used as a potential opportunity to address human, ecosystem, and animal health, including antimicrobial resistance and zoonosis. How do you think the One Health approach can be strengthened? That's a great question. So there are 5 options to choose from this time. Please also feel free again to add any other ideas or suggestions in the chat box so that your fellow participants can see and comment. So please go ahead and start answering that. Meanwhile, we will go to another couple of questions. So one of the questions that I have for Rajaswari is, you talked about, I don't think you put it this way, but essentially about how we built a system, right? We often think that we're just neutral actors in a system, but we actually build these systems and we can take them apart and deconstruct them and build them again. You talked a little bit about this. I'm just wondering, what's your vision for a new system? What would that look like?
Thank you, Ruth. I think in very simple terms, if I have to outline what's the vision, also again I'm reiterating that most of my perspectives come from the developing country and LMIC settings. I think one very important point which we would like to pick up is having a prevention agenda in terms of the food systems. If we are able to keep away diseases, if we are able to prevent them timely through measures which help us reduce the need for antimicrobials, or at the same time which help us, any kind of measure. It could be using alternatives, it could be having better vaccination strategies or better biosecurity models, or better farm management practices, better waste management practices. There is a lot that we can do. This prevention agenda needs to be strengthened, and it can take us a long way in building very good, in transforming the food systems, if I may say. But I also know that, this cannot happen overnight. This is long term, it takes its time, but there is always a time where we can start. And I think the time is right now. Yeah.
Fantastic, thank you. Darika, quick question for you. From a government perspective, just what is your main challenge as somebody working in government, and how do you see addressing that challenge?
I think the challenge is to make everybody aware of this problem. And I think Ministry of Health, we have many departments under the Ministry of Health that involve in the food safety. Department of Disease Control, Department of Health, the FDA. I think the Ministry of Health has to work actively to start to push this agenda, to be, aware, to be seen by all sectors in the country. And I think, from my experience, we have been working mostly on AMR, zoonosis. Sometimes it is in different platform. I think we now have to change it to one unique platform, meaning that we are working on the food safety, food security, including zoonosis, including AMR. So this will become a holistic approach. It will be a bigger picture, and we will have more sectors to work together and going on the same direction. And then that will make, more effective, and more achievement will be done by that way. Thank you, Ruth. Back to you.
Thank you, Darika. That's very much in line with our last poll, where the number one was integrated policy. So appreciate you underscoring the need for that. Thank you both. Really appreciate your insights today. And again, thank you for all the good work you do. Let's look at the poll now and see what the participants had to say about the One Health approach. So how do we think it can be strengthened? Number one, improve governance mechanisms at international and/or national levels. Interesting. Broaden the One Health approach to cover other issues beyond zoonosis and AMR. Engage a broader group of organizations, disciplines, including healthcare professionals, and down we go on the list. Very interesting. Thank you very much to the participants. This is a great way just to get a bit of a temperature test in terms of where your heads are at. It's also incredibly useful information and data for all of us as we try to figure out some of the pathways forwards and the solutions that we need to be taking into hand. So appreciate your contributions. All right, folks, we have one more panel for you. Before jumping into this panel, before jumping to our last panel, I'd like to give a few minutes to Gerda Verburg and Marian Jensen to provide some high-level reflections on what they have heard from the previous panels on the imperative to connect the three dimensions of health and how their organizations are supporting the transformation of food systems globally. So we have first Gerda Verburg, who is the UN Assistant Secretary General and coordinator of the Scaling Up Nutrition, or SUN movement. Gerda, your 2 short minutes on your reflections to the previous panels.
Thank you very much, Ruth, and I very much enjoy this very interactive forum because I've been very active also on the Q&As. But I very much also like the polls, and the first poll on nutrition, how to improve nutrition, is by better policies. That is the right way to go, because to end all forms of malnutrition and really invest in more health of people, animals, but also our planet, there needs to be the government ownership, not to show where the power is, but to serve the people and to serve society in the country, creating a more prosperous future. So thank you all for this. When it comes to the Food System Summit, there is a next step that needs to be taken, which is what is happening right now, is that indeed the health of people, but also the climate aspects are coming together in the food systems. And I would like to praise WHO and EAT and other organizers for organizing this event, making it so clear that the interconnection is there. But we used to have a siloed approach. And let me hope and pray and work with all of you to make sure that after the Food System Summit, we never go back to our own siloed approach again. We need to break down all the silos in a definitive way, because we will only be able to create a better food system if we are combining the interest of people, the interest of our planet, and the interest of the animals together. The challenges are interlinked, the solutions are also interlinked. Then I have heard a lot about the food value chain and how to make sure that smallholder farmers are able to get a decent income. This is important, this is crucial, because let's not forget that having healthy and nutritious food that is affordable and available requires a certain income. So good food systems also go hand in hand with social protection and decent levels of income for everyone. Let's make an end to having junk food being cheaper than healthy and nutritious food and more available. It's also needed, and it should be done in a package of incentives and taxes, carrots and sticks, so that those private sector companies who really want to be part of the solution can get the carrots, the tax incentives, and others who are not willing or who are naughty, they have to pay the taxes. But then also let's make sure that the tax benefits are looped back to the nutrition, food systems, health, climate agenda, so that it also serves a clear objective, and it's not only in the pocket of the Minister of Finance. When it comes to food workers, farmers, fisher folks, and food workers, very often they have very poor labor conditions. And I think organizing them or supporting them to organize themselves and creating negotiation power would be a one step. Making sure or making deals with multi-sectoral, multinational companies that they are responsible for the whole food value chain and create decent labor conditions and decent incomes is another one. And the third one I want to share with you, and is also an experience of the SUN movement that is working with multi-sectoral approaches at country level, but also with different stakeholders, workforce nutrition. Make a deal with the employer that she or he takes care of decent food and healthy meals for the workers. And at the same time create maternity leave and safe space for women who have given birth to a child to breastfeed their children also in the workplace. Finally, part of workforce nutrition could also be health insurance for the whole family, for the family of the worker. It is a win-win because healthy, well-nourished people are more productive and never want to leave the company because they and their family are proud of working there and having an employer that is taking care of them. So I have more observations to make, but I love the way this seminar is brought together. And once more, continue to ask questions. I'm happy to continue to give answers if I know the answer. But breaking down the silos and having more interaction, being ready to work together is crucial. And then one final remark, then we need to reinvent ourselves because we all need to change behavior. Leave logos and egos at the door, be ready to work together, step into each other's shoes to look at things, not only from a health perspective, but another time from a climate or an animal perspective, and try to find solutions that create win-wins. Thank you, and back to you.
Thank you, Gerda. Very, very important, interesting reflections. Very much appreciate you putting people at the heart. Really appreciate your shout out for true cost accounting, as we would call it. You talked about the cost of cheap food and non-nutritious food. Very practical suggestions around breastfeeding, maternity leave, insurance, etc. And also very much appreciate your shout out for personal transformation, as well as food systems transformation. So thank you for that. Next, we have Marian Jensen, who is the director of the Trade and Agricultural Directorate of the Organization for Economic Cooperation and Development, also known as OECD. Marian, please, your 2-minute reflections.
Thank you, Ruth, and thank you for inviting me to this very interesting dialogue. I will contribute some reflections on why it may have been so difficult so far to move from lose-lose-lose policies to the win-win-win. And will in this context mention the role of differences in interests and the role of differences in values. And I will then maybe close with making cross-reference to Gerda's point on breaking down silos. We have heard a lot about the complexities when it comes to many challenges we have when it comes to food. Food is intimately linked to many things that we value in our life, where the fact of being able to live, enough food, having a healthy life, healthy food. We have heard references to the role of food production for guaranteeing livelihoods across the globe. We measure that around 570 million of families live from farming. That's an awful lot, and we have to care about their incomes. And we have heard that food production is linked to environmental sustainability. Actually, wildlife is often threatened by an extension of food production, and food production also contributes to greenhouse gas emissions. So we call this the triple challenge. There are different ways of packaging this, but we speak in our recent publication on making better food policies for food systems. And here you see the logo we use for that publication about 3 challenges, making sure we have food systems contribute to nutrition, that they contribute to livelihoods and to sustainability. Now, we need to understand where we are currently and how we can move as fastly as possible to this new world, this new type of food systems where we want to be. And there, I would like to talk about a bit of frustration we have at the OECD. For over 30 years, we have been publishing a report that is called the Agricultural Monitoring and Evaluation Report. We published the next report on June 22. And for nearly the entirety of that time, we have been saying a lot of money is going to the agricultural sector. Most of that money is not being spent for win-win policies. They are spent for policies that neither increase productivity, nor really incomes of farmers, nor are they good for the sustainability. So we have done some soul searching on how come we have been messaging this for 3 decades and nothing happened. Our recent thinking goes in the direction that one of the difficulties lies in the fact that when it comes to food systems, we are dealing with very big differences sometimes between interests and differences in values. A major agro-food company in a value chain has a different economic interest than a smallholder who is supplying to that value chain. A consumer of food has a different view on what the price should be than the person selling the food. There are differences in interests, we have to come. But in the area of food, differences in values play an important matter, an important role. Eating meat may have a different value for me than for you, Ruth. Using new kind of technologies, new types of additives in food may be something I find of big concern, but Juan considers a great advancement. We need to overcome differences in interests and differences in values. And in order to do that, we need to break down those silos that Yada just mentioned. We need at the local, regional, and national level to design processes that help policymakers to understand where interests and values lie and how the differences can be overcome. At the OECD, experts working on health, experts working on the environment, experts working on trade and agriculture are working together in order to understand how to best help our stakeholders to overcome differences in interests and values. And we look forward to also work with you, Ruth, with the organizers and with the participants in this event in these directions. I look forward to that collaboration.
Marian, thank you so much. I wish this webinar could go on for a while because I would love to dig into your comments about interests and values, incredibly important, especially your point about values. Because that's ultimately what comes down to, what we're bringing to the solutions, what we're bringing to this agenda. So really appreciate that and would love to dig into that with you more at some point. But now we have to move on to our final panel, which is going to take us back to sort of a global perspective, each representing the human, animal, and planetary dimension of health. We have 3 panelists and a few simple but not easy questions for all of them. First, Johanna Ralston, who is the CEO of World Obesity Federation, which focuses on changing the narrative and elevating obesity on the global agenda. Welcome, Johanna. We have Philip Limbury. Philip is Global Chief Executive of Compassion in World Farming, President of Eurogroup for Animals, and founding board member of the World Federation for Animals. Welcome, Philip. And we have Juan Lucas Restrepo, Juan Lucas is the Director General of the Alliance of Biodiversity International and the International Center for Tropical Agriculture, also known as CIAT. Welcome, Juan Lucas. So, question for all of you. The last year has been a learning moment, to put it lightly. What have we learned from COVID-19? How has it heightened the interactions between human, planetary, and animal health and well-being? I will start first with Johanna. Please go ahead.
So thank you so much, Ruth. It's a pleasure to be here. And I just want to again thank you to all the participants, to WHO, to Dr. Tedros, Tusen tak to Gunhild, and thank you very much to the Global Alliance. So this past year, I think, has broken down some false dichotomies around undernutrition versus overweight and obesity in the food system. And that somehow food systems are separate from the animal sort of world as well. And I think that those things I'd just like to say a few points about. So really COVID's highlighted the extremes about all that's broken in our food systems, from its, the original association of COVID with unsafe food consumption on the one side, to what we saw as COVID played out in terms of increased mortality and morbidity, as our former colleague from Mexico also highlighted, for those with overweight and obesity related to COVID. And that's driven by a number of factors, but particularly exacerbated by consumption of ultra-processed foods and unhealthy beverages, which is, again, as Gerda notes too, associated with subsidies, with the wrong things being supported. So I think one thing that we found out in a report that we did on World Obesity Day was that 90% of deaths due to COVID were occurring in countries with high rates of obesity, which told us that probably COVID was the second predictor after age of, obesity was the second predictor after age of poor outcomes. And so again, it's just breaking down these false dichotomies between communicable and uncommunicable, between sort of undernutrition and overweight and obesity. And from these, we learned that really, an unhealthy population is a population that's at increased risk for pandemics. And so then again, as part of pandemic preparedness, we need to address this. So I think that's sort of the top line message around this. And then more broadly, it really highlighted the global syndemic on obesity, undernutrition, and climate change, which was our Lancet Commission report that came out 2.5 years ago, and really linked the three through areas, saying that in fact the solutions lie with areas like addressing each of those in single solutions, like, for example, reducing red meat consumption would both allow for increased sustainable agriculture, which benefits undernutrition, for healthier diets, which addresses overweight and obesity, and for reduced greenhouse gas emissions for climate change. So I think, again, we look through what are the opportunities that we've learned through the challenges of the past year as well. Thanks.
Fantastic, Johanna, great perspective from somebody with deep expertise on human health. We're going to turn now to animal health. Philip, what about for you? What are we learning from COVID? And how do we bring these things together? Please go ahead.
Thank you, Ruth. And to answer your question, I think out of these difficult COVID times, the one thing for me which we've learned is that the well-being of people, animals, and the planet are all interconnected, that there is one health, one welfare. And at its core, I believe, is the realization that protecting people means protecting animals too. So whilst COVID has been linked to the ill treatment of wildlife, a source of both past and future pandemics, I believe, is industrial animal agriculture or factory farming. Keeping thousands of animals caged, crammed, and confined is inherently unhealthy, producing the perfect breeding ground for disease. Highly pathogenic strains of disease can and do emerge. Only a decade ago, swine flu from factory farms caused a pandemic that killed about 500,000 people worldwide. Industrial agriculture is not only the biggest cause of animal cruelty on the planet, it is also a major driver of deforestation, decline in the world's wildlife, and a consumer of more than 2/3 of the world's antibiotics. It is also the biggest single source of food waste on the planet. 40% of our entire grain harvest worldwide is fed to industrially reared animals. If we fed that food directly to people, it would be enough to sustain 4 billion people, half humanity today. Yet as animal feed, much of the food value is wasted. At the same time, the global appetite for ever more meat means clearing more forests worldwide for farmland, encroaching on wildlands, and shaking free their novel viruses. So in this age of pandemic, climate and biodiversity emergency, Ruth, I think there's an urgent need to end factory farming and reduce the consumption of animal-sourced foods. Instead, replacing it with future-fit alternative proteins, such as plant-based, cultured meat, and the products of modern fermentation, together with ensuring that any animal-sourced foods come from farming that is health-oriented and regenerative. Now, the great thing about nature-friendly regenerative farming is that it has the power to be transformative. It not only builds back better soil health and biodiversity, it also provides for the very best animal health and welfare. Now, transformational change is long overdue. In the words of the UN Secretary General, transforming food systems is crucial to achieving the Sustainable Development Goals. But how do we get there? Well, in brief, the answer lies in business, finance, governments, the UN, and civil society all working together. It lies in food companies setting measurable targets for the reduction of livestock products. It lies in the financial sector ensuring that agricultural funding only supports the transition toward health-oriented regenerative farming. It lies in governments using policies for change, directives, incentives, and subsidies to steer away from factory farming towards health-oriented regenerative food and farming. Globally, governments provide $700 billion a year in farm subsidies, more than $1 million a minute, much of which drives climate crisis, wildlife destruction, and ill health. Let's take that money and redirect it towards regenerative farming and the uptake of alternative non-animal source proteins. Ruth, in summing up, I really believe that this year's UN Food Systems Summit offers a huge opportunity for all of us for a UN global agreement on food, an agreement that recognizes food's central role in the success of addressing health, climate, and biodiversity challenges, one that sets a course toward a health-oriented food system without factory farming and the over-reliance of animal-based diets, one that truly embraces that essential principle that protecting people means protecting animals too. Ruth, back to you. Thank you.
Thank you, Philip. Very clear call to action there from the perspective of animal health. So now we're going to go to the planet. No pressure, Juan Lucas, but what are we learning from COVID from an ecological point of view?
Thank you, Ruth, and let's move to the planet. I think COVID taught us the very hard and harsh way what some of us were already foreseeing in terms of risks, and we learned, for example, and Joanna mentioned this, how the pandemic hit hardest those with a poor dietary health. So obesity, overweight, diabetes, cardiovascular diseases, absolutely related to the death toll of the pandemic. We also learned the hard way how this over-reliance on long, production chains, transnational logistics focused on a very few staples created big shocks for large segments of society, and how those supply chains need to be rebalanced, probably looking for shorter chains, but also understanding that those failed somewhat as well, and that a lot of wet markets and farm markets, especially in the South, failed to deliver temporarily to people. So that element related to how we rethink supply chains is going to be absolutely critical. We learned, and you mentioned this earlier before, how unfortunately the poorest, the more vulnerable women, youth get hit the hardest, and how we really need to focus on protecting the most vulnerable population against these kind of shocks. In my country, in Colombia, we have a general strike of youth seeing a blurry future, and we're almost 2.5 million people that had better livelihoods and were going with enough food to bed are now going hungry. So we need to look at all of this. And of course, the other element we understand, and Philip mentioned that, is this very intricate relation between the natural habitat and how disrupting it increases the risks, the livelihoods of pandemics and overall crisis in health. So looking forward, we need to embrace complexity. We need to understand that we need to identify the pathways to feed almost 8 billion people in 2030 while meeting the SDGs. And that, of course, is demands that we rethink and reshape our food system. The Food System Summit is an amazing opportunity. Only this event of today is one of hundreds of dialogues that are ongoing. Agnes mentioned 2,500 solutions coming from across the board that are being synthesized and brought forward into this, what should be great coalitions, clusters, and people really coming out with these solutions across these 5 action tracks that make a lot of sense. It's the focus on nutrition, on consumption, on nature positive production, on equity and resilience. That's kind of the recipe, the ingredients for the recipe. Finalizing, and I don't know, we don't have a lot of time, focusing on how to produce in a different manner, how to boost nature positive production. We really need to identify mechanisms and pathways to shift agriculture towards these nature-based solutions to better manage production. And it's not only avoiding negative effects but really giving back to nature. It's really rebalancing how we do this. And of course, we are seeing that there are new paradigms, the agroecological regenerative paradigms that are being discussed and are one of these clusters, these coalitions that we are helping build. Agrobiodiversity and a few others should help us restore our ecosystems and get us into a new equilibrium. There is other elements, livestock, nature positive livestock, how to bring livestock under planetary boundaries is so challenging given the huge expanse of land it occupies and the pressure it puts on natural resources, as is of course seizing the amazing opportunity of blue and aquatic foods that can mean a lot for humanity in the future. The time is perfect. Embrace complexity, multi-stakeholders. Let's have the governments developing the frameworks, but civil society, the private sector, farmers becoming the engine of change to really get us within planetary boundaries and have a much nicer and better life for all of us and future generations. Over to you, Ruth.
Thank you, Juan Lucas. All right, so I have one additional question I'm going to ask you, and I'm going to literally give you 30 seconds each to answer it because we're coming to the end of the hour. Before I ask my question, one more interactive exercise for all the participants and viewers. In the chat box, can you please write down what your hopes and concerns are for the UN Food Systems Summit? So please, any thoughts? Please put it there. It'd be really interesting to hear what people are dreaming of, what your concerns are about food systems transformation. This is all part of the conversation. So please go ahead, comments in the chat box. My final question, 30 seconds each. Marian talked about making certain arguments for 3 decades. Everybody on this call has talked about solutions. Everybody's talked about a lot of things we've been discussing for a very long time. We have answers. We know what the pathways are. How do we break through and seize this moment? I'm sorry to only give you 30 seconds, but that's what I'm going to do. Philip, I'm going to start with you.
We need governments through the UN Food Systems Summit mechanism to come together, create a consensus, and take forward a global agreement to end the damaging industrial animal agricultural paradigm that has brought us to this broken food system place, end factory farming, and move on to a regenerative, health-oriented food system.
Thank you. You passed the test, the time test. Appreciate that. Juan Lucas, I'm going to go to you next.
Well, I see we need to resolve a skew and a very complex issue, which is that science research has been providing huge data in favor of paradigms or changes that are marginal, sustainable intensification, little gains, and not enough research and data on the new paradigms. So we really need to invest very quickly to make sure these agroecological regenerative paradigms get enough support from science to resolve issues at the landscape, considering the heterogeneity of and diversity in our geographies and cultures across the planet.
Fantastic. Thank you. Johanna, you get the last word.
Great, thank you so much. I'm going to actually respond a little bit to a couple of questions that were in the chat by this, saying that I think that people at the center is the most important. And while food at the center is vital, it's people who consume, drive, grow, etc. And we don't have enough of that here. We don't have the voices of hunger. We don't have the voices of lived experience. We probably do, but it's not articulated enough. The more there is a sense of ownership and devolved ownership is the best way. I will speak to somebody. I am somebody who's also lived with a chronic disease for 30 years, and food is part of my treatment. And there's so many of us out there. Why do we not harness that power and really use it so that whatever is happening, while we all trust, need, and support the UN system, we know that we need more than that. It needs to, the demand, the implementation needs to come from people at the center. Thanks.
Thank you, Johanna, Philip, Juan Lucas. Very much appreciate all the work you do and for joining us today. And with that, I will pass it back to Francesco.
Thank you.
Well, thank you very much, Ruth. This was really an exciting and rich set of reflections. So thank you for really so well moderating the discussion. Before we go to the close, I would like to give the floor to Dr. Omnia El Omrani. Dr. El Omrani is a young medical doctor from Egypt, and she is the liaison officer for public health issues for the International Federation of Medical Student Association, which represent the voice of more than 1.3 million medical students from 140 countries. And she's also the commissioner at the Lancet Chatham House Commission on Improving Population Health Post-COVID. Dr. El Omrani, you have the floor.
Yes, thank you so much for having me and for sharing such invaluable perspectives that I would like to give a quick reflection on and really highlight the role of youth as well as young health students and professionals in addressing the sustainability, equity of our health, of our food systems. So as mentioned at the beginning, that the COVID-19 pandemic has been a wake-up call to the vulnerability of our food systems, but also an insight into the ongoing threat that is posed by the climate crisis, both to nutritional security, but also the health of the current and the future generations. As a medical student and part of a global organization, I've seen how many medical students like myself were first-line responders by engaging with the community and emphasizing and advocating for having equitable and nutritious food systems that provide food for all. And at the same time, I've seen local activities from a medical student in Ecuador organizing and promoting the importance of doing their own plant-based meals, to a delegation of medical students at the last climate change conference in Madrid, doing a survey, asking the UN delegates and assessing their perception in terms of their understanding and awareness of how food systems, especially dietary change, is relevant to the climate negotiations. And our survey proved that the statistically significant interest by the UN delegates in food systems, but they also saw that less than 40% of them knew what a planetary health diet was, which means that there's a long way to go in terms of, as what has been mentioned before, linking both the climate crisis with the food systems agenda. But I would also like to highlight how youth as change agents, but also as the bearers of the consequences of the decisions and the policies made today, we need to be, and we are part of the solution. We are here, we are committed, and we are active, both on a local, regional, and global level. And we would like to have the space, a meaningful and sustainable space at the decision-making, as well as the policy-making table and frameworks that are being designed, as well as working both with our governments, but also with organizations like the WHO, the UN, as well as civil society organizations, and to be actively part of the solution formulation, implementation, and evaluation. And we are there to hold our governments accountable for the commitments that they are going to make ahead during the UN Food System Summit and beyond that. So I will just end my intervention with a call to action and an invitation for all of you, for the diverse sectors and the multidisciplinary conversation that we are seeing right now, to governments, to leaders, and to the civil society, to work with youth actively, meaningfully, and shape together a nutritious and equitable food system that is going to protect and promote the health of our generation, but also the health of the planet that will sustain us. Thank you.
Thank you, Dr. El Omrani. We need this energy of youth leaders to succeed. And this final energizing words bring us to the end of our very rich dialogue. Let me first of all thank the co-organizers of this dialogue, EAT, the Global Alliance for the Future of Food. Let me thank the speakers, the panelists, all the participants that followed us from Zoom and Facebook. And as a next step, we'll draft a summary. This is the practice of the dialogue. So we distill the main concept that came from the discussion, from the questions, the comments in the chat, the Q&A, and this will input in the food system process. So we will submit, and it will be accessible to all through the Food System Dialogue website, and so publicly available. So again, thank you very much, and have a great rest of this very interesting preparatory process for the Food System Summit.